welcome to today's IPHAM webinar series. I'm Ron Ackerman and I direct the Institute for Public Health and Medicine. I want to first thank all of you for joining today to take part in our presentation, which is part of a joint series that's co-sponsored between IPHAM and the NUCATS Institute, focusing on the intersections between population health and translational research. Before we begin, I would like to inform you all, especially those new to the audience, that we use a format that includes a presentation and a panel discussion, followed by Q&A with our invited panel members. So we encourage you all to submit questions anytime during the presentation, but you have to use the Q&A function, which usually appears either at the bottom or top of your Zoom screen. Please don't use that chat function because we won't be monitoring that for the questions. There may be information that comes up in chat relating to some reminders or information about our upcoming webinars, but please don't use that to post your questions. At the end of the presentation, our moderator will go through the Q&A and introduce the questions that you've asked. So today I have the distinct pleasure of introducing our topic, supporting the critical role of community organizations during the COVID-19 pandemic. And I want to turn things over to Dr. Nami Kandula, who's co-director for IPHAM Center for Community Health. Nami will introduce and moderate our panel today. Nami?
Thanks, Ron. I'd like to thank NUCATS and IPHAM, as well as our panelists, for creating the space to have this conversation today about how we can support community organizations during the COVID pandemic and hopefully after. I just want to begin by setting the stage of what was the motivation for today's seminar. I think throughout this COVID pandemic, we've really seen that community organizations are playing a critical role in providing services and supporting the communities that have been disproportionately hurt by the pandemic. And we're really lucky to hear from the leaders of 3 Chicago organizations whose work is focused on dismantling the barriers and silos that have created many of the health inequities that existed before the pandemic, during the pandemic. So it's startlingly clear that inequity is hurting the health of Chicagoans and that the price of inequity is really highest in many Black and Hispanic neighborhoods. This is a map of Chicago neighborhoods where a recent study has shown that Chicago has the largest life expectancy gap in the country. And residents living in the Streeterville area, which is the neighborhood that Northwestern medicine is in, live to be about 90, but just 9 miles away in Englewood, residents only live to be 60. This 30-year life expectancy gap, again, is the largest in the country. And we've seen a lot more attention being focused on the fact that these health outcomes are actually not the result of just biology, behaviors, or beliefs, but it's really the social and structural conditions that create these terrible gaps in disease and premature mortality. These social and structural conditions include things like structural racism, a lack of investment in communities, and concentrated poverty, all of which contribute to the many disparities that we have documented and are witnessing. So when the COVID crisis first hit, it became clear that a similar pattern was emerging again. Communities of color, again, predominantly Black and Hispanic neighborhoods, have suffered more catastrophic loss of lives and livelihoods over the past year. But yet, throughout the pandemic, we've seen that community organizations are providing a critical role to address issues like racial discriminatory practices and policies, housing, creating safer environments, and also pivoting to provide trusted information and addressing issues like equity and access to vaccines. So given the evidence and urgency around the health problems that we're facing in Chicago, as an academic medical center and as researchers, many of us are asking, what should we be doing differently? How can we operationalize equity in our mission and work so that everyone in every neighborhood has a chance to live a long and healthy life? And while it's hard work, I think it's also very joyous work, and that a lot of real change is happening and it's being led by communities and community organizations. So a critical step, and why we want to have this conversation today, is that institutions that can prioritize meaningful and long-term collaborations with communities and support the trusted community organizations that play these roles of providing social services can perhaps really lead to addressing a lot of the inequities and challenges that we're facing. So why community organizations? Community organizations really are assets. They are experts with knowledge on and expertise in understanding and responding to community needs. They know how to mobilize a community to identify and help solve social, structural, and public health problems. They're experts at working with policymakers and across sectors to change the structural and social factors that create health inequities. And there's actually good evidence to show that supporting and sustaining community safety nets can improve community health and long-term recovery during disasters. Strong, sustained relationships between communities and academic institutions can foster more meaningful research and provide communities with equitable resources and opportunities to improve their health. So I'm very pleased today that we are going to have a chance to hear from leaders at 3 community organizations about the work that they're doing to address health inequities in their community and the COVID pandemic. And so I'm going to begin by introducing them. First, Jessica Davenport Williams, who's the co-founder of Black Girls Break Bread. Jessica is a native of Chicago who has 15 years of experience in higher education, nonprofit, and federal sectors, and has been a champion for racial equity. Jessica has presented nationally and internationally on the affordability, sustainability, and accessibility of higher education, while also working to improve education equity in K through 12. In her work for the advancement of women and minorities, she serves on maternal and infant mortality task forces at the local, state, and federal level, and most recently pioneered an Illinois statewide forum to address the national crisis around Black maternal and child health. She holds an undergraduate degree in statistics and operations research from the University of Illinois, Chicago, and is a 2019 cohort member of the inaugural certificate in nonprofit management program at the University of Chicago's SSA. She's a loving wife and mother of 2 extraordinary daughters. Susanna Akras-Salul is the founder and executive director of the Syrian Community Network. Under her leadership, the Syrian Community Network has grown exponentially to become a strong voice for refugees and immigrant rights and a national community resettlement organization working in partnership with local and national refugee, immigrant rights, and faith-based organizations. She's led several community-based foundations and raised funds for many causes in Chicago and her homeland. Susanna is passionate about community service, advocacy, and human rights, and has received a UNICEF Chicago Humanitarian Award and the Illinois Coalition for Immigrants and Refugee Rights Annual Humanitarian Award. She's educated in nonprofit management and leadership from Lewis University and the Kellogg School of Management, and she also serves as a PTA president and board member at Universal Islamic School. She's married with 3 children. James Rudik is the executive director of the Northwest Side Housing Center, where he's led a significant growth of the center while also helping align its work through a revised mission and core values focused on developing resident leadership and responsiveness. James is a respected leader in the nonprofit community and is a member of the City of Chicago's Equity Council and Racial Equity Rapid Response Team. James serves on the Community Advisory Board of several organizations, including our very own Lurie Children's Hospital, and he's a graduate of the inaugural class of the University of Chicago's Civic Leadership Academy. James is also adjunct faculty member at DePaul University, where he teaches courses on race, housing, and politics in DePaul School of Public Service. So welcome to all of you. I'd also like to acknowledge our CCH community liaison, Ariel Thomas Sansing, who helped organize today's panel. So welcome.
Thank you.
I want to thank you for being here today, and we're going to kick off the conversation with a question that I have, which is, tell us a little bit about your organization's mission, how you've adapted during COVID, and about any accomplishments you want to highlight over the past year. And I'm going to, turn it over to Jessica.
Good afternoon. Thank you again for inviting me. It's a pleasure to be with everyone today. I am Jessica Davenport Williams, co-founder of Black Girls Break Bread, nonprofit organization based in the Chicagoland area that aims to uplift, inspire, and empower Black women and girls. The three of us founded this organization in 2016 in a means to address the social and emotional well-being of Black women and girls. Ordinarily, we would, pre-COVID, we would provide and create intergenerational safe spaces in partnership with academic institutions from middle school through post-secondary. However, as a result of COVID, we've had to pivot our programming to be able to address the immediate needs of our communities. In doing so, we have been able to provide food, clothing, and essential items for South and West Side communities in the Chicagoland area, as well as South Suburban Cook County. In addition, one of the critical areas that is very near and dear to us as a part of our advocacy efforts is addressing the maternal care deserts in Chicago, and predominantly on the South Side of Chicago. And so we've partnered with FQHCs as well as hospitals to be able to provide essential items for expectant and postpartum moms and babies in an effort to connect them with medical homes. And so that's been the ongoing work of our nonprofit. And so that's what brings me to this discussion today.
Thanks, Jessica. Suzanne?
Hi, everyone. Thank you for inviting me to speak and to be on this panel. I'm honored to be here. My name is Susanna. I'm the founder and executive director of the Syrian Community Network. We were founded in 2015 in response to what was going on in Syria, and having the State Department announce that Syrian refugees will be resettled in the United States. We mobilized and quickly organized and formed the organization to serve the needs of incoming Syrian refugees who will be, becoming our new friends and neighbors in the city of Chicago, and how to welcome them and how to ease their adjustment into life in Chicago. And our mission is constantly revolving around their evolving needs, basically supporting with services such as case management, after school programming, youth education and advocacy at the school level. We do also advocacy in support of refugee resettlement at the local and national level. We have an immigration department right now, and we also launch our citizenship classes for the refugee community. With COVID last year, this time last year when we started to hear about the deadly effects of COVID-19, and in March when we had the stay-at-home orders, we mobilized to rethink how we can serve our community from home. How can we do that? The refugee community is vulnerable, and many of them are at their early stages of resettlement, and they really need that community support and that be able to come to a community center that's theirs. And so we decided to work over Zoom, do our case management, our after school programming moved into Zoom homework room. And recently, one of the things that we're really proud of is that we were able, and at the tail end of 2019, we were able to receive a Department of Justice certification, means that we can apply for citizenship and green card for our refugee community. And so this year we launched our citizenship classes, and we just finished our first cohort. And so we're really proud of that. And we're about to start the second cohort with 60 plus members with a waiting list. So that's very exciting to be able to do all of that on Zoom. And we've actually resumed all of our services. We haven't stopped anything except the in-person workshops, but everything can be done over Zoom now. And one of the major things that we really focused on in the beginning was the myth of COVID. There was so much misinformation going around from on Facebook and everywhere. And so we developed talking points in Arabic. We did videos in Arabic from physicians, Arab American physicians here in Chicago, to dispel this myth and to give that information to the community in the way that they can, they will be able to be receptive to it because we understand the culture and the language and things like that. So I think that was very important to do. And we're currently doing some more series. Last Friday, we also hosted a Facebook Live in Arabic also to encourage people to get the vaccine. So these are the things that we've been doing, trying to give out some of the important information that can really be life-saving for our community in the language and the culture that they understand.
Thanks, Suzanne. James?
Hi, everyone. Good afternoon. My name is James Rudik. My pronouns are he and him, and I'm the executive director at Northwest Side Housing Center. We're a community-based organization that serves Belmont-Cragen, the 60639 zip code, as well as the broader Northwest Side. And as our name says, we primarily focus on housing programs and services, but our mission is to identify and respond to the needs of the community to improve the quality of life of the community. And so for us, our work helps provide free programs and services as well as community organizing to residents on issues related to education, housing, immigration, safety, older adults, and youth. So our work spans, multiple different areas, and we serve about 5,000 individuals a year. COVID-19 really caused us to change our work and pivot what we're doing, because if we really are meeting our mission of responding to the needs of the community for all of the individuals that I mentioned, there is nothing that's more important than COVID-19, from youth to older adults, housing, immigration, all of that was impacted by COVID-19. Belmont-Cragen's home to about 80,000 residents, 20% of which are undocumented. And we actually think that number is higher because it's underreported. And as we know, unfortunately, because of the federal administration's racist and xenophobic policies, undocumented and mixed status individuals were originally left out of the CARES Act support. Now mixed status families have been added in, but undocumented immigrants still have no support or relief as a result of the COVID-19 response. And so much of our work has meant helping that population. We've provided $500 direct assistance to families, laptops, space for e-learning, food, PPE, diapers, medical supplies, household items, provisioning rides for folks that need rides to get to and from places that didn't have access to transportation, weekly care calls for people that are shut in or isolated, that don't live with anyone, that have been at home for months. And all of that work really focuses on helping the most vulnerable in our community. So we still provide our programs and services, those that we can, online. And then our work has pivoted to this COVID response work. We have a call team that does weekly calls, a rapid response team that goes out and fills the needs for folks, again, dropping off the items that I described. And we have a team that's doing some placemaking work around helping businesses reopen, cleaning and sanitizing. So we've added 30 individuals to our organization doing that work, in addition to all of our other work as a result of the COVID-19 pandemic.
Thank you for sharing that. Clearly, what's clear to me is you've taken on many more additional responsibilities, all your organizations, above and beyond what you were already doing in terms of providing services in your communities. So how could an organization like Northwestern, or the researchers, the health professionals that work here, how could we help support the work that you're currently doing and that you're going to be doing even after this pandemic ends? I'm going to ask Suzanne to take a stab at that first.
Oh, sure. First of all, thank you. I know that we had submitted a grant application last year at the height of when we all went virtual. And thank you to Northwestern for funding our COVID relief emergency funding. So that's great. So of course, my number one answer is always to say funding, which is the easy answer. And but really coming together to create those relationships, I think, is very important within the community. We, as a startup organization and someone who, is very much in touch with the needs of our community, it would be great to, partner with community organizations like ours to build, pop-up, clinics, or doing more info sessions on, elder health, or, women's health, or girls' health, or things like that, that would be very meaningful to the community. And Northwestern, I've had many volunteers reach out from Northwestern who are doing research, who have done some initiatives, but really institutionalizing it and formalizing it into a program that empowers the Syrian Community Network and other community organizations to really be proactive instead of reactive whenever these types of issues come up. There's so much misinformation in the community. There's so much in terms of public health, in terms of just general day-to-day health that we sometimes take for granted, but don't realize that the refugee community, or communities that are underserved, or communities of color don't have access to. The fact that you mentioned the age, life expectancy disparities, that in itself is really sad. I feel sometimes Chicago is a tale of two cities, where you have pockets of Chicago that are doing so amazing and so well, and it's so nice, and then you just drive a couple blocks down, and it's a completely different area. So I think this is something that as a strong institution like Northwestern can invest in communities of color to build up a certain infrastructure that can be life-saving. I live in the suburbs, in the west suburbs, and in a very, in a very good, comfortable environment. And I see a lot of the bigger institutions opening health centers and health clinics, whether it's Northwestern, UFC, Loyola, others. Of course, it's needed, and and that's a great thing that we're investing in the infrastructure. But I think it's time also to take a look at some of the gaps in the Chicagoland area, whether it's the south side, or the west side, or the north side, to see where those beautiful clinics, those beautiful buildings can be in the community, or empowering community members themselves to open pharmacies and clinics and things like that can really make a difference for people. Every time I hear on NPR, the other day they're talking about the COVID vaccine and going to your local Walgreens. One of the ladies who lives in the South Side said, "Well, I have to take 2 buses and walk I don't know how long to get to a Walgreens." That should not be the case in Chicago. And here in the suburbs, in the western suburbs, every corner there's a CVS and a Walgreens, literally within every other block. And then you see such huge disparities in other communities. So I think the short answer is invest in communities of color, institutionalize certain programs within minority communities, so that there is a really good infrastructure for health, and so that instead of being reactive, that we're proactive, and that we're really caring about the needs of women, elders, children, men, people who, mental health services that can really make a difference in our city and in the lives of people.
Yeah, it's interesting. I mean, a lot of the things that you're talking about are things we may take for granted, and not even recognizing what huge gaps there are in these basic sort of services and infrastructures, which makes me sort of think that we do have these silos, right? We live in sort of these closed areas and don't necessarily look outside. And this is something that I think, Jessica, you had brought up a little bit when we spoke previously. And I guess I wanted to ask you to also react of how Northwestern might be able to support this critical work that an organization like Black Girls Break Bread is doing.
Yes, much to Suzanne's point, is being able to engage with community organizations, but also having an understanding of the history of Chicago, the history of the state of Illinois, and how there are these large institutions that have been complicit in these structural barriers and institutional racism that exists today. And so when you talk about the life expectancy gaps between Streeterville and Inglewood, understanding how the medical district, right, was built, understanding the intention behind that, understanding how the University of Chicago's campus was structured and the intention behind that. And I think that's important for people who come to study, you know, in Chicago that may not be natives of the city and understand, you know, the pervasive residential segregation that has existed in our government and political structures that, you know, control many of the things in this state. And so that would be great for, I think, for researchers in institutions that have so much influence in the city to be able to have an understanding of the structures and the root causes, right? Because it's one thing to be able to deploy financial resources, which, you know, many community-based organizations need and our communities need, but those are just Band-Aids, right? Like we really have to get to the root cause and be able to dismantle some of these structures and policies and legislation that will continue to impact, you know, our communities and perpetuate this disinvestment. So when, you know, God forbid, we don't see another pandemic in the way that we have, then you won't see this mass devastation, right, that we're seeing even as we're approaching a year of this, you know, stay-at-home order. And so that's my perspective of, you know, just kind of stepping behind those walls and really engaging with the communities to have an understanding of, like you said, their pharmacy deserts, right? Their maternity care deserts, this lack of access to physicians. And it just exacerbates the farther south and the farther west that you go in the city of Chicago.
And James, can you talk a little bit about some of the work you all are doing to address some of those kind of structural, institutional barriers and how Northwestern could support that work that you're doing?
Yeah, definitely. I just want to echo everything that Susanna and Jessica said. I definitely agree with what they shared. And I think for us, we're at the table with the city of Chicago through a collaborative called the Racial Equity Rapid Response Table. And it brings together Westside United, which brings together some of the medical providers that Jessica talked about, along with community-based organizations on the West Side and the South Side and the city to address some of these issues. Something that I've shared with folks is that these systems that we're talking about are really just not built for equity. And we see it in the way that testing, COVID-19 testing has been delivered, as well as even vaccination distributions, right? And the easy access that certain folks have. So we're trying to change that. This weekend, we had a vaccination site at our local high school in Belmont, Craig and Steinman. So we vaccinated 1,900 individuals, almost 2,000 individuals over 2 days. And we're already changing those numbers in terms of the percentage of Latinx individuals that are getting access to the vaccinations. And so we're working hard to try and rebuild the structures and the systems that have and continue to benefit white folks and wealthy folks in Chicago and the surrounding areas. But it's hard work because it's not just about what we're doing here now, but again, we're going back to change policies that have been in place forever that benefited individuals that folks may not even know about. The challenges with systemic and institutional racism is that they're not always in your face, right? They're not always individuals saying or doing things, but rather they're invisible to us. And a lot of us don't even see them or know them, particularly white folks in power, right? We struggle as white people to see that systemic and institutional racism around us. And we often don't, intentionally, but sometimes unintentionally are actually furthering it, right? So to disrupt that system takes a lot of work and a lot of personal reflection and learning and supporting our brothers and sisters of color. I would say for Northwestern, what I think can be done in addition to what my colleagues on the panel already said is I often think about as small nonprofits, our resources are so often limited. And then I too thank Northwestern for providing direct financial assistance to us. I think that's super important and needed, but our resources are limited and we're always going to have more need than we're able to address. And I think something that we often struggle with is how to measure success and impact and outcomes of our work. So whenever I think of these large institutions and systems and universities and medical centers, I wonder how the researchers and the doctors and the PhDs can help help support tracking the outcomes and impact of our work and researching our work, because we know the impact of our work. You've heard the stories from Susanna and Jessica. We know that it's changing lives on the ground. I can tell you countless stories, but if we don't have the data, we don't have the numbers, we don't have the research to back it up, it actually makes fundraising for our work that much more difficult. So I see an easy connection there between the folks that are on this call and their expertise being able to support our work and help us understand how to better track it and also just talk about it, right? We can share the stories, but how do we frame it in the language that funders are asking for, the government's asking for? Because that's not our lived experience. It's not the lived experience of the people we serve. We just know what people need and we do that. And so sometimes we need to step back and figure out how to frame it. So I would welcome the support of folks on the call to help us think through that and provide us with tools and resources for that.
Just want to make sure if, Suzanne, Jessica, do you have other thoughts on ways that researchers or institution could support the work that you're doing? I think this is a really great opportunity to have this conversation, so I want to give this enough time.
Yeah, if I could just add, I know that we talked about this on an earlier call as well, but most time for funding opportunities or for research opportunities is driven by funding that's available, right? It's driven by what someone gets approved for. And so, definitely for an organization that's advocating for Black women and girls, I see this across the country. There are limited opportunities for programming, for funding that is explicitly stated for the progression of Black women and girls, for an understanding and analysis of how the structural racism or the barriers impact us. Like we see general statistics that maybe, the public health agencies produce, like you said, oh, the life expectancy gap is this, or the #1 causes of, death is this, breast cancer, treatment and cure is this. But there's really not much more granular detail outside of those main categories, that we see this targets women and girls. And so that would just be my desire, is for, researchers to actually look beyond the surface and choose to dig a little bit deeper to be able to improve these life, this life expectancy, right? Like, how do we truly close this gap? And it shouldn't just be centered around men. Unfortunately, there's a lot of data, a lot of statistics around men. And so hopefully elevating that need from our organization standpoint to be able to work closely with institutions to be able to generate more data so that, the powers that be and those who are funding and philanthropic organizations can see quantitatively, but then also qualitatively being able to incorporate lived experience, I think is very critical because it moves beyond the numbers on the paper.
Suzanne?
I don't have anything into everything. I don't want to repeat, but I agree with everything you said.
Thanks. Jessica, you had mentioned before also just that sometimes it feels like researchers go back to the same organizations over and over. Can you say a little bit more about that as well? And how we could broaden our...
Sure. I mean, this is from direct experience. I sit on many task forces at every level. And to James's point, like Westside United is fantastic, right? But it's centered around the medical district. The city of Chicago pretty much taps, or these research institutions, they tap this pool of organizations that are common. And so when you think about what's happening like on the south side of Chicago with 300,000 persons of reproductive age, and you see what's happening with OB units that are closing at, startling rates, and you're wondering, why you don't see the list of FQHCs or, local providers from the south side or far south side included in those lists, it's really because there's just been a lack of engagement historically. And so being able to strengthen that, if there is a need for increased connection, because, you know, sometimes, you know, as a director, you know, of a center, you may have a certain Rolodex, right? You may just know a couple of contacts, and you may not know how to get in touch with the CEOs or the, you know, the providers that are operating in a different area than you've probably inherited. And so, you know, being able to open that dialogue and conversation, and like I said, look beyond the walls or the documents from what you have been accustomed to actually build those relationships in other areas of our city.
Thank you. Suzanne, so how would you encourage researchers, or how would you orient them to starting these conversations and dialogues with community-based organizations, and to understand what truly matters to the communities that you're working with?
So a lot of students will reach out to me, or researchers will reach out and say, you know, we want to do this project with you, or this and that, or we want to, listen, you know, have a listening session with different clients to hear their story, how they came to the U.S., what was their experience. But it's often re-traumatizing for our clients, because they've had, you know, these are war refugees who've escaped war, and by the time they made it here, they're exhausted, basically. And so it's very hard sometimes to find someone who will participate. And if they do, they share their story and then they're left. And then they have to grapple with all of the feelings that now are, you know, again, have risen to the surface. So I think one thing to do is to provide mental health services, or some kind of support in Arabic, or in the language of whatever community organization that you're reaching out to continue that relationship. So it's not just a one-off, I get your story and I leave you. So this is one of the things that I have a hard time with when I have to work with people on research because of that issue. Another way that someone like Northwestern, having your name, you're branded as a very credible organization, as someone, you know, like the name of Northwestern, you know, is very meaningful. And so being able to provide translation services in Arabic or whatever language is just, it really goes a long way, or to provide those services in Arabic to begin with, and not necessarily translation, because so many times we will send clients to this hospital, that hospital. There's never any support for them. You know, we have to get on the line, and you have to get on a translator line, and it takes forever, and sometimes that's not always available. So something like this, where you can create that more welcoming atmosphere, if a researcher were to, follow up with different hospitals and different care providers and see how language access is, identified, and how we can improve language access to communities, immigrant communities who, really have a hard time, and, things get lost in translation when how many times, like, I wouldn't even know the correct terminology sometimes when the doctor would tell me, and I speak Arabic. And so, things like that. So I wish that we can invest in this, the language access piece, to make it so, equitable for everyone, when they're seeing a doctor or a dentist, or when it's something major, or there's, more support for mental health services in the language, and without an interpreter, so that, people feel supported, and feel included. I think it's very important to feel the sense of inclusion in any society, wherever you go, to be part of the fabric of the society, where, that you're valued, and your language, is valued, and your contributions are valued, is, I think, very critical, and for equity and for inclusion. That will take away a lot of the hardships that some of the, initial things that happen in the beginning, and that, I think, will go a long way to creating more support, more understanding, a better, from a public health standpoint. I think it will go a long way, especially dispelling myths and things like that about COVID and other health-related issues.
And so one of the things that I'm hearing from you is that the questions or the issues that researchers may initially bring are not the issues that necessarily are helpful to communities. And so it's important to really like think about what are the needs of the communities before posing perhaps some of the questions that we as researchers might have. And so James, could you help us out a little here and reorient us as a research community, as an academic institution, about what might matter most to the communities you're working with, to your organization?
Yeah, thank you so much for that question. And I think for us, it starts with just having this conversation and this reframe. And I think the reframe is for us is about even asking that question, right? Because I think all too often folks are well-intentioned, but they come into communities already having the questions in their mind or already having the questions answered, or those perceptions. And again, we know that those perceptions are often based on historical realities, right? Of racism, sexism, homophobia, all of that. And so I think for folks to come in with an open mind and ask, right, is actually the first step, right? And we're doing that right here in real time. And I only emphasize that because I think if you do that, you're going to get the right answer, because it's going to be different for each community. So what's important to Susanna and Jessica and the folks they work with might be different than what's important to me and Belmont Cragen. So for us, the questions are really about how are we making impact, right? And for folks, they need financial support, right? We often talk about COVID tests, behavior change, masks, social distancing. That's all really important. But if folks can't put food on their table, can't pay their rent, they have to make decisions. And these really are life decisions about going into work or not. Even if they don't feel well, if they're day laborers, they don't have access to pay time off, their employers aren't giving them access to information that they should know about. So for us, we think that like the conversation and the narrative that's out there, I think in Chicago around like, well, folks are making bad decisions or bad choices or people aren't being responsible, should be reframed to ask folks like, why are folks still continuing to go out or still continuing to gather? Or what's the number one reason why people are continuing to go to work? And what we hear is, I don't have a lease. My landlord's threatening to kick me out. I can't pay my rent. So I'm making decisions to continue to earn money, even if the conditions aren't safe, because what else is my family going to do? And I don't speak the language. I'm not supported by the government in any sort of assistance. So I have to make this work, right? And so I think if we can reframe the narrative in which it's about individual responsibility versus systems and structures, that's so important for us, right? Because so often it's about what an individual did or said or does and their own behavior versus thinking about systems and structures that are at play that lead to the conditions that we're in. And how do we step outside ourselves to have that conversation about the system that we're operating in, right? The fact that the phone systems that we have, aren't in the language that folks need, the fact that the paperwork isn't clear, that those of us on the call running organizations can't figure it out. How does someone who's just come to this country that doesn't speak the language, how are they supposed to be able to figure it out? So I think we need to shift our conversations from personal blame, personal responsibility to more about how are systems and institutions and communities impacting individuals and their behavior, and how does that those two things coalesce in real time in people's lives, and what's important to people. I think we have to ask them, right? What are your priorities, right? What's important to you in your household? And I think that feels like something that we should be asking folks again, instead of just blaming them. So that's the main reframe. And I think the reframe happens from individuals listening to people in communities.
Thank you so much. This is really, really critical information, and it's inspiring to hear all the great work that you're all involved in. I want to turn it over to our audience that's listening in, because there's already some questions coming through. Make sure that we have time to answer them. So I'm going to read the question out loud. And whoever wants to take it, please feel free. So this is from Precious Walker. How did the lack of support from the government impact your organization? And moving forward, what policies do you want passed to ensure your organization can function during the rest of the pandemic and future pandemics?
That's a heavy one. Starting off,
yeah, maybe we can start with, how did the lack of support from the government impact your organization?
Yeah, I'm happy to start, and then let Susanna and Jessica also share their thoughts. I think government disproportionately allocates resources, and I'll talk about Chicago, right? We know that, for example, TIF funding, right? The tax incremental financing district. So we know that TIF funds are used for projects in communities in which those funds aren't necessarily taken from, and that money then is used by the mayor and the city to invest in projects that may not be in the target communities in which they are supposed to go toward. And so for us, wealth and money is amassed in the city and then distributed by individuals that are not in community and without the input from community, right? And I know that just yesterday we saw that there was $281 million of COVID-19 funds that went to support the Chicago Police Department, and that there's millions more that's left on the table, right? So those are very real examples of where we're seeing that the government is making decisions that are not in line with the work that we're doing and work in communities that's impacting us. And so the problem is so great that it's actually hard to quantify it down at times, because I don't even know what could be possible if millions of dollars. I mean, we could have more testing sites, we could have had at-home testing kits, we could have had on-the-ground outreach, we could have more vaccination sites, we could have public awareness campaigns. I mean, it's so great. We're talking about millions and millions of dollars here. And so I envision a world where Black and brown folks are disproportionately invested in, not invested in, right? And so in order to make up for the historical lack of investment, there has to be reparation style investment in these communities, right? Not just equality now, disproportional investment. And so I think those are the policies that need to move forward to impact Black and brown communities and low income communities.
Yeah, I just want to add what James was said. Also, you know, the fact that we don't have the right infrastructure to do the vaccine rollout, that in itself is, I shudder to think, like, why is it that we don't have you know, healthcare workers or pharmacists or anyone who's ready to roll out the vaccine, and there's such confusion and chaos, and I'm just shocked. You know, I'm an immigrant from Syria, and this is something I expect, you know, from a smaller third world country. But seeing this happen here in the United States, I think is shocking. My husband works at one of the safety net hospitals in St. Anthony's Hospital on 18th in California, and just the fact that they, you know, and not just St. Anthony, but other hospitals, that they don't have enough ICU beds, they don't have enough ventilators, they don't have oxygen, they don't have, you know, all of this, seeing, you know, and then the large numbers of deaths that are happening in Black and brown communities really, really shows the disparity in our city, and how really we have to invest in these communities in order to build up that key infrastructure that has been lost, in order to prepare for the next pandemic, so that we're not reacting, that we're, you know, being proactive and supporting communities. You know, those hospitals are doing their best. They're great hospitals, and I think more investment needs to go in to build up those communities, because they're serving such a vital, you know, area in the city of Chicago. Otherwise, if these hospitals are left to, you know, kind of sink, and you know, I you know, wonder where people would go if they had an emergency, or, you know, yeah, I think that for me, the biggest failure is in the government rollout of the support services that are needed for the larger community.
And Jessica, just responding to some of this information that we're learning over the last couple of days about sort of the lack of government funding for organizations like yours, and the fact that a significant amount of federal funds have gone, you know, to support the Chicago Police Department. Are there things that you're advocating for? And this is still Precious Walker's question, to that policies that could support an organization like yours?
Yeah, I mean, unfortunately, this is kind of like on brand, right, for the state, for the government. I mean, even if you look at the history of why nonprofits were created, you know, it was always to fill a gap in what the government could not provide, you know, for the poor, for the sick, right? And so there will always be a shortage, in my opinion, because that's just the structure of how this country has built nonprofit organizations, right? So we'll always kind of be in this mode of panic, right? That we know what's happening in our communities, we know the needs, but there's never enough funding. And it's almost disheartening to see, like during the pandemic, that you have large trusts and organizations, foundations or institutions that are just saying, oh, now we have 20 million that we can disperse, you know, to 75 organizations, or now, you know, like Blue Cross just issued another grant opportunity that 1.5 million. And it's like, almost, if there was a true need or a concern for the needs of our communities that was ongoing, you know, how could this type of funding be able to help revitalize and, you know, restore some of the inequities that we see and disparities that we see happening in our communities. And so it's just a part of our advocacy, is just continue to elevate the awareness, continue to be the voice at the table, speaking for those who feel invisible, right? Who feel as if they don't have the power and authority to change their own lives. And so being that vehicle to say that, no, this isn't a monolith, right? Like, you may want to fill, you know, as a researcher, you need to fill a sample, right? You need to, you know, complete a data set, but every community is not the same. Every person in the household, you know, they don't have the same needs. And so being able to raise awareness to that and advocate for those within our communities is all that we can do.
Can I just add one thing I meant to mention about the funding? As to what Jessica said, you know, when a lot of community organizations started rolling out grants, and I saw some of the list, the grantees, I mean, there were huge organizations of like, that have millions of dollars in a budget, and they, you know, they have endowments, they have, big donors investing, and then all of us, you know, mom and pop shops were on the bottom of the list and didn't get anything until the third or fourth round. And so I think like just that in itself, I think was very disappointing that right away, like different foundations, although I'm grateful for everyone who has supported us, but although right away the major money went to bigger organizations that do have, reserves and, they have ways of sustaining themselves, whether through, because of their endowments and things like that. But we rely on, people, individuals, and some state grants and different foundations to support us. And we're barely like, oh, we might have a small revenue this year of $500 when we finish our end of fiscal year, so, and where people finish sometimes with a reserve of $1 million, so just that part, that was disheartening. And I just wanted like more foundations to pour money to smaller organizations that I think would be really meaningful.
Thank you. I see we have a few more questions, and so we'll try to get through them before we wrap up here. I guess 2 questions that are related, one from Tabitha and Monaghan and an anonymous attendee, sort of about federally qualified health centers and having physicians who stay and serve underserved communities and not just leave after a few years. I guess want to understand from your perspective, are there F2HCs that you've seen that are doing a good job responding to the needs of people in the pandemic? And how do we build the capacity of physicians to stay and work in underserved communities?
I can start with the first part. The second part, again, is a big question. But for the first part, what I would say is that we have seen the FQHCs do a tremendous job. And in Belmont-Cragen, we have PCC Wellness, the PCC community, but Wellness and Salud are their sites, Prime Care. We've also seen Community Health. We've seen all of our FQHCs, as well as Lurie Children's, as well as Rush, do a really great job trying to respond to this. I think the challenge is the coordination, right? The FQHCs are woefully understaffed, and the amount of staff and volunteers needed to staff these large vaccination sites, no one FQHC is going to be able to bring enough staff. So for example, at our Steinmetz site, we're vaccinating 1,000 people every Saturday and 1,000 every Sunday. We need roughly 65 to 70 volunteers. And so there's no way that an FQA, I mean, that would be more than the entire staff of the FQHC, right? So how would they be able to staff that? So I think it's not that FQHCs are not doing a great job. It's how are we connecting FQHCs to larger hospital systems and volunteers. So I know that like Northwestern has put out the call to volunteers to come volunteer at that site, and also make sure that there's community there as well, and the city, because they're controlling the vaccine doses and the site. So when you think about all of that, it makes this that much more complicated. And so I think FQHCs have responded. They're at the table, they're doing outreach, they're getting vaccines to folks. It's just a little bit like a step up of that, where I think the coordination needs to be a little bit tighter.
Great, and we'll just move on since we have about 5 more minutes and we have a couple of things to do in terms of wrapping up. I did want to give each of you some time, a minute each, to kind of give us some closing thoughts, but I was wondering if you'd perhaps respond to one of the questions in your closing thoughts, which, you know, we often ask, like, how can we build trust in communities? But I'll reframe it just a little bit if the attendee doesn't mind, which is, how can we, as Northwestern, be more trustworthy in the communities that you work with? And I'm gonna ask Jessica to respond first.
Yeah, thank you again for this invitation. This has been a wonderful panel. I think to be able to strengthen or gain the trust of the communities, there needs to be a pipeline, even internally, to be able to include faces and voices that are reflective of the communities that exist in Chicago. So understanding the dynamic and the demographics and being able to reflect that, I think, is a huge step for our large institutions. And then externally, being able to engage with community-based organizations and, you know, other fellow, you know, providers and clinicians, and, you know, health centers and hospitals that are in some of our marginalized and under-resourced communities would be my ask.
Suzanne?
I'd love to see Northwestern not just partner, but kind of adopt a healthcare center, whether it's in the west side or south side or north side or wherever the need is, to help build infrastructure, to help grow their capacity, to help, you know, making sure that they have the tools they need to save lives and to, you know, whether it's to be a better ICU or whether it's to have a better nursing program, or whether, you know, they need, you know, in Jessica's case, you know, more maternal health, things like that. I would love to see something like this. And so that really we're, all of us, you know, we're putting our money where our mouth is. And so this way we really are building something together, you know, sharing resources, having physicians and nurses that are qualified to work in those centers. You know, my husband's a physician, and you know, a lot of times, you know, people will ask him, well, why are you at you know, St. Anthony or this and that, and he, you know, he also practices at Christ Hospital, and there's a huge disparity, and he loves St. Anthony because it's, you know, it's a community like our community, and so you know, sometimes you know, people went to studied nursing and medicine because they wanted to help people. So at least that's the intention, that should be. And so I you know, I call on all the doctors and all the healthcare workers to, you know, find a center that, you know, maybe is underserved and underprivileged, and to actually work there and volunteer your hours. If anything, you will be enriched, and you will, you know, find so much reward, and setting a really great example, and encouraging the larger, you know, hospitals to, like I said, like adopt a certain ICU or adopt a certain, you know, facility that can really change the lives of the people who are in that community, from, you know, disparity to support, and, you know, just kind of helping build up that community with services, I think will be will really go a long way. And I would love to see Northwestern take the lead in this, and from the institutions use its brand to leverage all the resources and the support in order to build up different communities.
James, any final thoughts?
Yeah, I know we're right at time. So the only thing I would add is just a holistic approach, right? So what Jessica and Suzanne said, we really need to do this coordinated and holistic. So it's not just funding or dropping in, but coordinating all of that support and wrapping it all around and all in. So going deeper and not necessarily broader. So thank you.
Thanks so much. I know we are at time, and I just want to remind everyone that if you're inspired and excited after today, that our Center for Community Health does have several programs and resources that can help you build strong and sustainable research partnerships. And I've listed them on this slide. We don't have time to go through each of them right now, but you can learn more by visiting our website on the Feinberg website for the Center for Community Health. And then lastly, again, I just want to thank all our panelists, Jessica Davenport-Williams, Suzanne Akras-Balul, and James Rudik. And you can read more about all the grantees from the CCH COVID Response and Recovery Fund at the CCH website. And I really encourage you to connect with these organizations and think about how you can support them long-term in a meaningful way. Thanks so much.
Thank you. Thank you.